really.
Okay, continue.
Okay, so I should say, welcome everybody. June 9th, 2021. This is Diversity, Equity, and Inclusion Worker Privileges. And we're going to cover today the topic of data. In previous meetings, we talked about the importance of understanding your community, who is in it, where they live, and what information we can glean from large databases so that we can use that as a guide, as a tool for our equity and inclusion work. And so we are very fortunate to have a couple of wonderful people from HHS to help us identify places where you can find information in an easy, hopefully accessible way. And I'm going to just pass it on to Dennis and Tamar. We're going to plunge right in so that there will be enough time for them to show you what they want to share, as well as have you ask your questions. So I'm going to.
Sounds good. So I'll share my screen. Should be this one. And everyone can see the map, I'm hoping.
Yes.
Okay, cool. So what we wanted to do today is normally for these kinds of meetings, we do try to put in some tailored maps and stuff like that because of all the vaccine work still. We're a little bit restricted, but what we thought we could do is to show you how the county has been using mapping and demographic data for the vaccine effort in particular. That included initially a very big focus on the 65 and over population, obviously. Then what we can do is Tamar can talk a little bit about how we try to look at our community in a little bit more of a general sense. And then after that, I'll try and dive into specifically how we've been compiling data on the county's older population, both some of the data that we have on the demographics of villages themselves, which is in the annual report, and then also a tool that we have built out for the Age-Friendly Montgomery initiative called the Aging and Vulnerability Dashboards. That has a lot of good information, but at this point, it's about 3 years old or so in terms of the data that we used for that. So we would love to update that, but not just do a sort of like a, cut and paste, replace the data in there, but maybe think through a little bit how we may further evolve that tool also with like different lenses to add and stuff like that. So I think that is a useful tool as it is. But I think we can also make improvements, and we'd like to embed those as we're also updating the data for that. So on the map right here, we have these series of maps, and I can share the link out for I'll share all the links in the chat a little bit later, so you can also look at these yourself. But for the vaccine work, we created this outreach planner tool, which is all geospatially, it's all based around maps. So in this case, we can show different kinds of vaccination sites. For instance, this is the list of all the locations that the state has identified, some of the county's fixed sites, but then we can also map it relative to senior housing facilities or rental facilities. So initially, this was work that we and A&D have been working on quite a bit, is to identify some of these high density senior housing facilities for some focused outreach there. We can look at things like grocery stores, which at one point was also a priority in terms of the workers there, and various boundaries. So one of the things I can add here is the villages boundaries. So what you see on the back here is the red areas are the census tracts. Census tracts are basically homogeneous neighborhoods that split the county up into 215 different regions. Usually they have fairly common socioeconomic type characteristics. And so what we do is we can look at both the percent vaccinated for 65 and over. So the red areas that you see here are some of the remaining neighborhoods where that rate is lower than this for other parts. So for instance, here around White Oak, it's only at about 63%. Still pretty good compared to nationally, but quite a bit lower than the county as a whole. And then this part here up by Fairland, it's only at about 61%. So again, not terrible compared to some of the national numbers, but quite a bit below what we have seen in the other parts of Montgomery County. So if I go in here, for instance, we're up to, according to the data, like up to 100%. So, and I'll show you some of the further breakdowns there too. So Right now, also, we're looking in particular at the under 65 population as sort of the population groups transition over. And at this point, we're actually looking in particular quite a bit at the 12 to 18 population. Now that a lot of that group is eligible for vaccines also. So going back to the 65 and over layer, what we can do now too is to look where the villages sit in relation to this. And here, for the most part, this is in the area, the mostly green areas. But for instance, here we do see that around that Fairland hotspot, that there is potentially some opportunity for the local village there to be of some assistance. I figured it'd be good to show, particularly with the vaccine work right now, because that's obviously a very hot button issue and something that we're really focusing on operationally. But what's nice about all these different mapping tools that we use is pretty much anything that we built out, we can always add this village layer. And then that would allow you to then see, whether there are certain hotspots in villages or near villages, and compare villages against one another. That's essentially the approach that we took. So instead of the percent vaccinated, let me turn that off and instead look at some of the demographic layers. So for instance, we can look at percent Hispanic, and then I'll bring back make sure I have the villages layer on there. We can compare that to percent Black African American, and that's for the all age groups, not necessarily older adults. I'll go into some breakdowns a little bit later. Or we can just look at the density of the 65 and over population. And so you can kind of overlay that information. And then what we can do is we can have our tools actually run the numbers around this. So if you've seen the Senior Villages annual report, for instance, that's basically how we get these numbers, where we take those census community data, and let me increase the size of this a little bit. Where we take that census data and we try to roll it up as close as possible to the villages. So then we can see the number of residents age 60 and over in the different villages. We can look at lower income residents. So in this case, Silver Spring Village, about a third of the 65 and over population has an income below 35,000 per year. And you can see how all the other villages kind of rank there. We can look at diversity. So that's what the ranking is here. And median household income, so that's pretty similar to that lower income part that we looked at. Or we can just look at the share of residents living in that village that are older adults. So it's kind of how concentrated the older adult population is in those different villages. So those are some of the, and then we also looked at 85, what they call oldest old, 85 and over. So those are the metrics that we had identified that we thought would be useful for this annual reporting. But these tools are fairly flexible. So if there's other kinds of metrics like this that you would be particularly keen to have, we should be able to run that again using these different mapping tools that we have. So, we can overlay any of the stuff you see here, but also some of the stuff that Tamar will show you, and then I'll go into it a little bit more detail later. Just in terms of the vaccination specifically, one of the things that we have been tracking was how equitable the access to the vaccinations have been and how well we were doing if we look at our community broken down by race and ethnicity. I'll increase this a little bit.
Yeah, increase it. Thank you.
For all this data, we try to specifically break out 65 and over from the 12 to 64, in part because particularly, yes, sorry. Okay, so I'll continue. So in part because when we were vaccinating 65 and over, there was a lot more of a shortage of the vaccines. And so the approach had been a little bit different where essentially the county had a lot more ability to kind of direct the vaccines and stuff. Whereas now that vaccines are ubiquitous, it's sort of less an issue of availability and more an issue of being able to get to the site, the hours at which they're administered, and some of those factors that may impact access, but it's no longer really the supply piece. So pretty much every time when the county opened up to a new age group, we did see a pretty big spike in the disparities Usually the Asian and Pacific Islander residents in the county were very effective at sort of obtaining the vaccines. But what we saw is pretty much in every case, and this replicated for 12 to 64, but even if we break that down further to say 50 to 64, or when we open up for the 12 to 18 population, usually what we see is an initial spike in disparities that peaks at around a 20 percentage point gap. And then over time that falls back down to 0. And in this case, actually, at this point for the 65 and over population, we actually have a slightly higher vaccination rate for Black or African American residents 65 and over. And for Hispanic residents, that gap closed a little bit more slowly, but they're essentially at that point of convergence too. So we still have a lot of work to do in the 12 to 64 age range, particularly for our Black and African American residents. But a lot of this is kind of following that same pattern that we saw. So that gives you some insight in terms of the overall equity lens that we've been applying to the vaccination work. So what I figured I would do now is to kind of step back from the vaccination work, which has kind of been the hot button issue. And what Tamar could do is talk a little bit about how we look at equity and the way that we try to identify needs in our community using something called the Social Vulnerability Index that's developed by the Centers for Disease Control. And then after she's done that, I can dive into a more tailored version that we developed that's specifically looking at the older adult population. So I'll kind of log off here, and then Tamar, let me know if you have any issues sharing your screen.
Okay. Let me just try. Come on, window. All right. So the Social Vulnerability Index, as Dennis mentioned, it was developed by the Centers for Disease Control. It basically aggregates a lot of census data. So the problem with census data is there's so much of it that it's hard to just look at, each measure and kind of understand what's going on. So the idea is, can we get a big picture of what a community within a census tract looks like, and what type of vulnerabilities do they show, by creating kind of an aggregate measure that puts all these aspects together. So they divided their index.
Tamar, can I interrupt for a minute? Is there a way you can enlarge your screen?
Yeah.
Was it really small?
Maybe
Yeah.
just a little bit bigger, just for convenience.
Sure. There we go. This is
Is it better, you guys?
Yes.
Okay.
Yes.
okay. Sorry. It's so hard to tell.
Sorry for interrupting. Just want to make sure people can see what you're saying.
Totally fine. Please interrupt me because I can't see what you see, obviously. So the Social Vulnerability Index, the way they've composed it, it's composed of 4 different aspects, and then within each of those aspects or components or whatever we want to call them are all these various measures. So statistically, they kind of aggregate these up a level. So from here, they go to a score on socioeconomic status, and from all of these, they go up to a score on overall vulnerability. And these types of measures are really useful because, as I said, a lot of data can get overwhelming if you're just like clicking through each of these. But if you have the big picture, you can kind of understand more about a community's vulnerability. The one thing about this index is that it was actually created to see a community's ability to respond to a hazardous situation. So, for example, a pandemic. So pretty fitting for most things related to health in our case, but the overall goal, as Dennis mentioned, is to kind of tweak it better to better match our community. So like some of these things are not as applicable to Montgomery County as they are nationally, which is what this index serves to do. So mobile homes, for example, we don't have a lot of mobile homes in our county. So some of these measures can be tweaked, but for now we kind of use it to just gain a better understanding. So one other thing we did is when the CDC puts this out, they put it out, I believe, every 2 years. So it should be updated soon. They rank census tracts in relation to the rest of the census tracts within the United States. And what we thought would be more effective, because Montgomery County can kind of look like, one big well-off community compared to the rest of the United States, is break this down see how are these census tracts performing relative to other census tracts within the state of Maryland. So that's kind of the one adjustment we've made so far, just to tweak this a little bit. And we created this visualization. Right now it's showing you guys, and I don't know if you can, is this big enough for everyone?
No.
No, okay.
No.
I would just see, to me it looks big, so I'm not sure how to make it much bigger. But
Okay.
You also close, if you close your chat, you might get a bigger screen out of it.
this one, did you guys see this?
Yeah, for everybody, I'm just telling you, close your chat box, you'll get a bigger view.
Okay, hopefully this is, and we'll share this link with you guys so you can kind of click through this, but basically this is a visualization of the social vulnerability index. On the top right, this is very hard for you guys to see, I'm sure, but there's a drop down menu here. You can click through all the measures that compose the social vulnerability index. So here's one that Dennis showed you, age 65 or older, and it'll update, it'll update the map for you. And you can see, hopefully, here, for example, is Leisure World.
Yeah.
They are, you know, the darkest color means their highest concentration, lighter colors mean lighter concentrations. So here's one that's a little skewed by an area like Leisure World. The rest of the map is very light compared to them just because of how it's broken down. But there's other measures here, for example, percent minority, that are kind of more enlightening. So that aggregates, you know, rather than breaking down specifically by race, ethnicity, this basically aggregates all the non-white population and shows you where the concentration of non-white population is. And here it is along this corridor, which is a theme that you'll find as you scroll through a lot of these measures, particularly the social vulnerability index aggregation. So socioeconomic status, the darker means that they're more vulnerable. Here's that corridor again alongside East County border with the other counties is another hot spot. So, you know, it's a good kind of tool to play around with. It's a little different than what Dennis created. With Dennis's tool that he just showed you, you can kind of layer one layer on top of the other. This one is a little more straightforward in that you, if you want to see, you know, where it's the highest concentration of non-native English speakers or English speakers, people who speak English less than well is what the census question is. You can see kind of the census tract in areas where that's the case, and you can actually zoom in on the map to, if it's hard for you to see that this, for example, is around Gaithersburg, and you zoom in, you can kind of get a handle on where this is. I'm trying to think, Dennis, is there anything else that you think that we should be highlighting about this that I've forgotten?
No, I think that covers it. So I'll kind of take charge back.
Great, let me stop my share.
Oh, let me make sure I have the right browser here. And apparently the map is using the senior villages layer from I think early 2019 or so. So I've actually updated that. So as soon as you get off, that'll be updated. So you have the absolute most recent version of that on the COVID outreach maps. So back when we were doing the age-friendly Montgomery planning, that you probably had some role to play in and have, I'm assuming this work group has pretty good awareness of that. We wanted to take a little bit of a data-driven approach to how we identified the needs that we were seeing in our community for our older adults. And so what we wanted to do is to kind of take that national concept from the Centers for Disease Control that looks at the community very broadly, so all the different age groups, and to come up with a version of that that's a little bit more specific to our older adult population. And we actually did this in partnership with Age Friendly DC, and we made this tool available for pretty much any of the counties in the DC metro region. So the first thing that you'll want to do when you access this is just to make sure that you're picking Montgomery County here, so that all the data is specific to our county. Sorry, that was a refresh thing. So Montgomery County. And basically this walks through a couple of different tabs. But if you click on the overview here, just like how Tamar showed you, it kind of walks through the different components that we embedded into this vulnerability, aging and vulnerability index. Some of this is very similar to the CDC index. Other pieces we got from something developed by the Corwin Institute at Ohio State University, where they had something called the Senior Vulnerability Index. So we took those as kind of inspirations and came up with something that seemed to make sense for Montgomery County. So, you know, the idea here is that instead of trying to show you maps for all those different components, because there tends to be a tremendous amount of overlap, that we actually just build it into one index. Then from that index, you can see what the high need neighborhoods are. And then by clicking on the neighborhood, you can see what specifically might be driving that need or vulnerability. So I can move from here to the actual mapping. So this is the official aging and vulnerability map for Montgomery County. Again, this data is about 3 years old. It's not going to change that dramatically from year to year, but it would be nice to update the data again, but also for us to collectively think about, well, what else might we include here, or how might we tweak that index? So again, if you wanted to, you could look at the same thing for the District of Columbia, or for, say, Charles County, Maryland. We tried to make this a tool that's useful for the whole metro region, going back to Montgomery County here. And then what we also wanted to do is to provide you with some breakdowns. So say your work is specifically looking at the equity piece. So what you could do is to zoom in only on the diversity subcomponents, or say you're really focused in on transportation issues, you can zoom in just on the housing and transportation index, and that will kind of update it and show you which neighborhoods are particularly scoring high or low on those different components of the index, if you wanted to do a little bit of a breakdown. One of the other things we added here, which we thought was important to do, is in addition to giving it sort of a red, yellow, or green rating, we also wanted to indicate if that area has a very high or low density of seniors. So for instance, this area right here is very high need, but only about 9% of the residents there are older adults, whereas there's a high need neighborhood here where 27% of the residents that live there are older adults. So that gives you both a sense of the vulnerability, but also just how dense the senior population is in that particular area. If you wanted to, you can go down to even the individual indicators. So we could look at, for instance, seniors living alone. We could look at older adults with housing cost burdens. We could look at the old, 85 and over. You can see which of these is sort of relevant for whatever you may be planning for, and then kind of have the map focus in on that particular component. So we could also look at older adults that speak a language other than English at home. And for all of these, you can actually go down to the individual neighborhoods and then see what that percentile rank is for that particular, or what that value is for that particular community. So let's see, which one would it be? Might be, yeah, this one here. So this part of the county has the highest rate of older adults speaking a language other than English, and it's actually more than 3 and 4. So that may be relevant for outreach work and stuff like that. So it kind of gives you that particular breakdown. And again, you can click on any of these: Medicaid enrollment, food stamps. Hopefully some of these are relevant to what you're planning for. Community stats, that's really more just to look at the overall community profile for Montgomery County. And if you like, you can do some benchmarking with this appendix here. So here, we can look at, let's leave all of those, but in terms of just the actual 65 and over population, we're actually #1 in the DC metro region. So Fairfax has more residents than us in total, but we have more residents 65 and over. And if we wanted to look at the diversity of our senior population, Montgomery County, so we're ranked relatively high. Prince George's is #1 in the county at 75%. DC's at 67%, and you can kind of do some benchmarking across the metro region. Same thing here. If a lot of times our analysis kind of stops at the border of the county, when a lot of the trends and demographics actually very much kind of flow in across the borders. So this is a way that you can look at all this information just for the DC metro region as a whole. It also allows you to kind of see the level of vulnerability in these different components in our county versus the other parts of the DC metro region. We built in this piece, which is kind of shows you some changes over time. So this shows you just how rapidly the 60 plus population has grown. So in 1970, this is where most of our older adult residents lived in the DC metro region. Go to 1980, you'll see that grow out. If we go to 1990, you see it expand further. And basically by 2000, it's really also, there's a lot of much more suburban areas that have older adults. And so, whereas before in the county, servicing older adults maybe could have happened sort of in that 495 inside the Beltway type area. Obviously, at this point, it's really a county-wide phenomenon. So just the last couple that I'll show is we have a tab on diversity. So this shows you for each of the four main race and ethnicity groups where we have the highest concentration of older adults. So for instance, for the Asian residents 65 and over, a lot of it is more in the western part of the county. Hispanic residents is kind of the up county region around 270, Wheaton, parts of Silver Spring. Black African American residents, a lot of that is more focused in East County. So it kind of shows you that the distribution for different groups. And if you wanted to, you could do the same thing for DC. So one of the things you'll find in DC, for instance, is a lot more, there's you know, you can kind of see some of the historical patterns there. Whereas in Montgomery County, we're known for being a relatively more integrated community. So that's what these maps tend to show you. And again, we could also do it for all the entire DC metro region also. And that will give you some sense of where Montgomery County ranks. Although I'm on this small screen, the border's kind of obfuscating some of the information. There's some other metrics in here. I won't go into too much detail, but we have a dependency ratio so that shows you the 65 and older and children population relative to the working age population. We have older adults to children. So there's plenty of parts, and let me zoom in specifically on Montgomery County. So we have plenty of communities, neighborhoods now in the county where we actually have more older adults than children. So that obviously has a lot of implications for what the service delivery looks like there. And we have a little bit of a proxy for aging in place. And we've done some more work on this since then. So this is something we may be able to improve. But this is essentially looking at the percent of householders that are 65 and over that have lived in their home since at least 1990. So it's kind of a proxy for this concept of naturally occurring retirement communities. That's something that we also looked at for the vaccine work. And I think we can get a little bit more sophisticated on this piece. So lots to kind of click around here. It's sort of really intended to be the one go-to place for data on older adults and equity and vulnerability and helping to identify what particular needs there may be and figuring out how we might tailor outreach to different communities. That said, it's been around for about 3 or 4 years or so we can update it with all the more recent census data. But that also gives us an opportunity to maybe rethink what kind of metrics we include, how we may present this to you in the most effective way. So now would be a really good time for us to get some further feedback on this tool and how well it works for you, either just through a Q&A session, or if you want to kind of digest this, use it at your own pace, feel free to also email us with any feedback you may have. So I'll kind of leave it at that. I don't know, Pazita, if there's anything else you can think of that would be good for us to show, but that was kind of the main pieces that I was hoping to present today.
Thank you, Dennis. This is really amazing. I think I didn't realize how extensive those two layered maps are. And I guess I have a couple of questions. I'm sure other people have additional ones. So let me just ask you the first one. So you said that the information that these maps draw on is about 3 or 4 years old, but you think that you would be able to have more current information in the coming year. Is this the timeline?
Yeah, so I think if we could, I would like to have some version of this that's updated by the end of the calendar year. One thing to note, because this data gets down to those individual 215 neighborhoods in the county, we have to use the census data that covers a 5-year period. So right now what you're looking at is, I believe, something like 2012 to 2016 that data was collected. At this point, we can have data, I think in September, they should be releasing newer data. So then we can do basically 2020 and the 4 years before that.
Wow.
And that gives
That'd
us
be great.
actually like the full, almost a full 5-year separation. So because it's that 5-year average, if we compare 1 year to the next year, they're really sharing 4 years of the same data. So it just doesn't change that dramatically. But with the 3 or 4 years that have been passed since then, I think now it would definitely be worthwhile to go back to the data and just update the maps that we have here, but maybe also make some improvements. So certainly the ways that we might have proxies for aging in place, I think there's some things that we were experimenting with for the vaccine work where we can make some improvements there, I think.
Yeah. So I think because this is a rapidly aging community, I expect to see some pretty significant shifts in the way the data is presented in this map. And then once you guys update that, so it'll be really interesting to see those changes.
Yeah. And
couple
definitely
of-
also from the diversity perspective too.
Yes, for
Right.
sure.
With the and so I think we will see that when we plug in the new data.
I
The
have
other-
one question.
Oh, go ahead, Kendall. I'll say.
My question is housing type. Because most villages, people are still living in their homes. So that would be interesting for us to look at the various type of housing types where villages are located. And I know we do have senior housing that people live in by Montgomery County or so, when in low income housing. That might be interesting to look at.
Yeah, that's a very good point. And at the time we had some ambition, the data hadn't quite come together, but there's been a lot more work on that recently. Planning had done a really excellent study that provided us with some lists. And again, for the vaccine work too, we definitely use that kind of data very extensively. So I think that's a great point. That would be a very good addition to this, I think.
Thank you.
This
Appreciate
group
it.
has also been talking about disabilities overall. So I know that the census does ask a question about people with disability living in a household, and that would be another interesting layer to add, as well as people living alone versus people living in family that are a lot bigger than one. If we're trying to understand social isolation for older adults, I think these two would be two really essential components for outreach and inclusion.
Yeah, we have living alone here and residents with more than one disability, but that one we could expand a little bit.
No, it's good. I didn't see that. That's really good.
Usually when we're looking at this, mapping out residents with disabilities for all age groups, the challenge we have there is it's very driven by, very correlated with age. So a lot of those maps are just tracking where older adults are. But if we're looking at people with disabilities for the older adult population, then I think that there is some value to having that mapped out.
Mm-hmm.
Yeah, I have a question. I looked at the map and I wonder, you pointed out Leisure World, but there was one other community north of that had a significant number of seniors. I'm wondering what that was.
We can actually go back to this one here.
My guess is that it's the Sandy Spring area. There's a couple of retirement communities there.
Yeah, I was just curious. There was Leisure World and then there was one other.
Yeah, so the other big one is Riderwood.
Ah,
And
okay.
right after that we have Ashbury. So those are the three big ones by far. But only here has Brook Grove Retirement Village, Willow Manor. So there's actually some newer ones sort of roughly in that area that we're probably not fully capturing, but in part because of the wonderful work that Bazit had done with the vaccine outreach, we do have this data already. So it would just be a matter of bringing this over to the other tool that we have. And I definitely think that facilities and housing piece, that's a very important lens that we did not get a chance to really embed into this tool when we did it at the time. So I appreciate that feedback because that definitely is, I think, value adding.
Thank you.
Thank you.
I have another question, Dennis. When this is an extremely awesome visual tool, if a village wishes to extract numbers in a simple way, does the tool allow you to like maybe download by census tract number of people, or people have to do their own sort of identify which census tracts fall within their village and then do the math? I know I'm asking for a lot, but I'm just trying to make it easy for villages to aggregate the numbers for a particular data they're looking for.
Yeah, that may be one way to do it. I'm trying to get a sense of, let's see. Definitely the bigger villages, their alignment with the census tracts is pretty strong. There's some, in this case, there's a huge chunk of this. Well, that one's actually outside. Sometimes that will work, other times it might not. But I think also the other thing we can do is just for the annual reporting, and this could be more frequent than, well, actually the data doesn't change more than once a year. But what we could do is just also making sure that we have some additional metrics when we run the numbers, and making sure that we can kind of report on those things too. So the most simplistic way would be to just know which census tracts are in which senior village, and we can run the numbers on that in kind of like a lookup table.
I see.
But
So can people turn to you guys for a specific question to aggregate data for them? I don't want to burden you guys with too much though. So
yeah, and if those can be clustered, then that makes it easier because there's just a lot of efficiencies by doing multiple ones at the same time.
okay.
But in our tool, it's really just, hey, tell us, basically compare these two layers and spit out the numbers.
Okay.
So as long as, there's not like order changes that we also need to account for, and it's just pulling those numbers, it's not a super intensive exercise. And our tools, depending on how we do it, they can actually make some estimates about, that are more detailed than the tracts might be. So say in this tract, most of this is like a lake or something like that, and most of the population actually is right inside of the part of the tract that's also covered by the senior village, then the tool will be smart enough to make those kinds of adjustments. So there's some benefit to just having the machine basically run that for us.
That's great.
So maybe in the next session or even before that, if we can collectively decide on the kind of matrix you guys want to request, then we can put it together as a compiled list of villages that we would like to get this information for.
Yeah, but
Pazit,
the census tracts don't necessarily correspond to zip codes, do they?
that's true. But I think if we know the zip code, then Dennis can help us use that as a source for data.
Yeah.
Okay.
Mm-hmm.
Dennis, this is Eddie. A question, can we actually, as individuals, go in and play with these maps ourselves?
Yes.
Like
So
for those of us who are nerdy enough to want to spend hours playing with them and looking at stuff?
No, like we love that, because then if the tool can answer people's questions, then that's kind of less work for us. So we love to kind of push these out. So in the chat, I put the link to all these tools, and I know Tamar's still been working on hers, but if she's comfortable with the way it is now, she can put the link in the chat also, or else we can provide that when she's gone through like another iteration of that. But almost all the chat.
So
Okay, perfect. Yeah.
there.
So in the chat, you should have all the links there, and we can also kind of send it out by email too.
If you brought that would be great.
Yeah.
For some of these, it may take like a second to just load up because there is a lot of data behind some of these, but usually they perform okay, I think. But yeah, any kind of feedback you have, whether it's about the actual like data elements or just the user experience, now would be a great time for that feedback as we kind of think about what the next version of this might look like.
I'll be fussy and this is a personal peeve of my own. If you can eliminate the use of the word minority for all us people of color, that would be my personal preference.
Yeah, and this is basically using matching the census data, but we can tailor all this stuff. So
what word would you use, Eddie?
People of color.
Okay.
Because, again, in conglomeration, we're no longer a minority.
Yeah.
Right. You're right. Not in the county, for sure.
I think that here is just denotes the way these data sets are referenced in those sources. So the US Census, what they call it, not necessarily how we view it here.
Yeah, I mean, the census changes every couple of years how they categorize people, given
Very
what the
true.
latest trend is.
Yep.
I mean, this past year was the first time that I wrote in mestizo and figured, who knows how they're going to count me with that. So it'll be interesting.
Dennis, do you know if there's any data sources on LGBT anywhere? I know that this is not necessarily anything that people track, and I'm just curious to see if we have any.
The census as they kind of always kind of had the data, but they are reporting on that in some capacity now. I think it's not necessarily LGBT directly, but it's same-sex couple households, I think is what they're able to track now.
Kind of as a proxy measure of that.
Exactly, yeah. And I believe that's only like in the last 5 or 6 years or so.
Now, that would be a really interesting data set for communities to have.
And presumably that may also be have like an age filter that we could apply.
Yeah, that's pretty awesome. Wow, this tool is, far exceeds anything we've ever seen so far. I mean, I know that, Dennis, you've been sharing these tools for internal HHS purposes, especially on vaccinations, but making this available to everybody in the community as they make their planning or just looking for deeper knowledge of the communities is pretty amazing. I'm grateful for you and Tamar for putting this together.
Yeah, and there was a lot of work put into this just during the H-Friendly Montgomery effort. So all the departments contributed to it. There's a lot of requirements gathering. So it's really a kind of a countywide effort. And even H-Friendly DC had helped out a little bit also. So it's definitely a collaborative effort at the time. And we can continue to make sure that we take that approach with us.
I have a question, very kind of basic question that I may be suffering from lack of imagination. I mean, this amazing amount of data is here. Can you maybe tell us some of the ways that we haven't, or I haven't thought of, that the villages could best use this?
I think so. I think a lot of the interesting data trends in Montgomery County are really looking at changes over time. So, and that is something that this tool doesn't necessarily do that great a job of. So that's maybe something else that we could look at. I think part of it for planning purposes, just to identify what the particular needs may be. So, is there a high share of residents that are living alone? Do you have a very high concentration of 85 and older? And what might that mean for programming and stuff like that? In terms of outreach, what about the languages spoken in those particular neighborhoods and having some additional language capabilities and things like that? So those would be some of the ways to do that. But that's where we like to bring in people like Bazit, because they always have really good ideas for that kind of stuff, so that we know what data to bring around for their particular use cases around that.
Okay, thanks.
I was honestly fascinated by the fact that the concentration south of Germantown of where English was not used as much, and it was clearly not the Latino community. So it said to me, heavy Asian concentration.
That is correct. That's a good update.
From a village perspective, there's a population that is scattered as far as I can tell in participation in villages. But it would just say to me that if that community was going to focus on a village, there'd have to be some incredible grassroots work done there.
Yeah, but to the same point, if I found out that in my village, we had a very small concentration of people over 65, then we wouldn't use numbers of participants as a measure of success.
Oh,
Because, yeah, you wouldn't, because you'd find some other metric, because if you only have a few percentage, then what do you do to help build a community? I mean, those are the questions you have when you don't have that many people. So who are that age? Because I think I live in a fairly young community. So I don't have the numbers that Bethesda has, or you in Silver Spring, Doug.
Yeah, you know, the amazing thing is just the diversity within our diversity in Montgomery County. Like I know in Friendship Heights, for instance, the number one spoken for non-English language there is actually Greek, which I had no idea about. And Russian is very common also in sort of like the Turnbrook area and stuff like that. So it was pretty amazing just how diverse our county is, sort of the diversity within our diversity.
Right.
Mhm.
The other thing too is we have East County where some parts French is the number one language, but that's more the African community. And then in Bethesda, we have 2 zip codes that actually are, I believe, number 2 and number 3 of all zip codes in America for the number of French speakers. And that's much more
Wow.
like the embassy crowd and all of that in the French school and those kinds of things.
I think this is an incredible educational tool for us and for our community.
I'm glad we recorded this. I'm definitely going to download this and share it as a YouTube link with people so that they can make use of it for other purposes as well.
Yeah,
Thank you.
the tools have evolved also. So one of the things that we had a lot of challenges with, and it's still not super easy, but in this particular tool, which is very good in how interactive it is, it was very difficult to kind of overlay multiple things. But now that that's easier, we may just be able to give you like a checkbox so that you could see the village boundaries just right put on top of this. Same thing with like the housing bubbles and other things like that. So that hopefully that would be one way that we can evolve this tool some.
A reminder to everybody that we're probably going to need to be using this tool if indeed the state rolls out that money that was passed for aging in place grants across the
Right.
state.
Yep.
Granted, we don't want to be too selfish since we have the highest concentration of villages, but and I'm sure that the Department of Aging is not going to be excited about Montgomery County getting all the cash. So, but food
I
for
think
thought.
you're right, Eddie. Eddie, it's a good
Yeah, but we
advocacy
have the
program.
highest number of older adults in the state. So
In the county.
proportionally speaking,
Yeah.
it's
We do, but again, think about communities for a lifetime or whatever it's
Yep.
called. The
Well-
competition with villages.
I hope that we will find some equitable way to distribute these funds.
We will
Yeah,
work.
Yeah, I think we did great during the pandemic with sharing programs.
Yes.
I think we have a model of how we can work together, I think.
But and certainly in terms of the data, just looking at the DC metro area, and again, this is a pretty rough proxy for aging in place, but it's, you know, a fairly reasonable one too. We have some of the really key hotspots in the whole DC metro region, so that does kind of speak to the, you know, the fact that we do have a lot of qualifying communities for this.
This is great for those
Yeah, it is.
those nerds that like census and maps together. of which I consider myself one of them. So
Ditto, yeah.
You don't have to be a nerd to enjoy those.
Yeah, but it tells a story. It actually tells a
does.
story, yeah.
It does. And an important one too.
And gives you valuable information about your geographical area.
Absolutely. Pictures tell
Yeah,
1,000
definitely.
words or whatever, you know, whatever
Yeah,
that
yeah.
expression.
Yep. Yep, it does. It puts a face to the picture.
Uh-huh, it does.
It does.
Okay,
well,
so in
thank
terms
you,
of
Dennis
action
and
items,
Tamara.
Yeah, thank you both. This is great.
Thank you so
Yeah.
much. We greatly appreciate you taking your time for us today.
And
Yes.
so, Vizit, you've agreed to have us send you what we might want, and then you would compile it and send it to Dennis?
I think so. I think what we'll also do, if you can use the, you know how I send reminders? If you can use that email to share your ideas for different data, because we want to be able to create a list that everybody agrees on. I mean, I'd rather be more expansive. It's not as though people are going to give up certain indicators, but perhaps some people's ideas on what they would like to have captured in their village would then inspire other people. So it will be kind of a list of indicators that everybody know will get a sort of a product at the end for. Does that make sense?
It does, it does.
Are you going to send this out to all the village leaders? Or are you gonna limit it at this
You
point?
know, it's a really good question. Maybe we can bring this up in our next Montgomery County Village Leaders meeting. I don't want to just send something out without giving context. So then people
Yeah.
will getting very angsty over like, why is this, that? So we're gonna
Or,
give context and then get some input. And this recording can also be another source for people to get the information. So
right.
um,
The other thing I was gonna suggest was that if you wanted to start with us and with David and Tamara, Dennis's and Tamara's permission, let us be the test case for the first group that starts giving you information,
yep.
desires, and then as we work that out, expand it out to all the other villages. Because I mean, the fact that there's data here for Prince George's County as well would be good to include those villages and
And DC, yep.
and Virginia,
Yep.
because
Yeah.
it looked like there was Virginia stuff too.
Correct.
Yeah.
Yeah, and the tricky part again is when you get to this, the first thing to do is just to go in the drop down and pick Montgomery County.
Okay.
Yeah.
Okay.
Again, thank you for taking the time.
Right.
I
We
think
did
we're out of time.
identify.
We have a few more minutes, so maybe we can stop the recording.
Okay.
Pazit,